Assalamu alaikum. Join as soon as possible. Very important lecture today. Pathophysiology. Okay. Everybody knows what to write in the examination, but they don't know what to write in pathophysiology paper. Just by practicing these, I have already loaded one important question. Means the important questions of pathophysiology. Now in this video, my main concept is to how to write, what to write. The main content of this video. Special class for you all. This one is. Let's join fast. Anyone send the group link? Link in the group. Join fast because in this video we are going to discuss a very important session, live session. How is your PIC paper today? Is it easy or difficult in organic chemistry? I think the paper was very easy. ಬೆಂಕಿ ಬಿರುಗಾಳಿ ಸಿಡಿಲು ಮತ್ತೇನೈತೆ ನೋಡ್ರಿ ಎಲ್ಲ ಹೇಳಿಬಿಡ್ರಿ ಹೋಗ್ಲಿ. ಹೆಲೋ ಸರ್, ಗುಡ್ ಈವ್ನಿಂಗ್ ಮಯೂರ್. ಹಾಯ್ ಸರ್. ಮಲ್ಲು ಹಂಡಿ ಹಾಯ್. See, I'm inspiring from you. Hi bro. Okay, inspiring from you. Really, one positiveness is arising in my body. Just I'm not doing this for fame. No. My main intention here is just to participate with you, just to make happiness, to create positive things inside the body. That is only very important, no? You don't worry, tomorrow's examination will be, all of you will be passed, definitely. You don't worry about that. 110% in tomorrow's examination you will pass. Let's start. See, now, just I will directly come to the point. Write in detail pathogenesis of the stroke, 2019 question paper. Now what I should write in the stroke pathogenesis? See, if you directly write the pathogenesis of the stroke means, then definitely you will get 3 marks there. Okay, you will pass in one day. Just practice whole night. Definitely will pass. If you write only pathogenesis of the stroke means, you will get only 3 marks. For how many marks? For 10 marks. Here first you write what is this stroke. See, stroke, it is a central nervous system disorder. Okay, and also stroke occurs in the heart. 2 types of strokes are there. But here we have to prefer CNS, central nervous system stroke, where what happens, stroke is the CNS disease in which less amount of oxygen reaches the brain cell. Okay, that leads to hypoxia or ischemia. Inshallah, really you will pass in one day. Just to concentrate here. Okay, less amount of transfer of oxygen through the brain cell or the brain neurons, that leads to hypoxia or ischemia. This condition is known as stroke. First you write that what is stroke. Then see, After writing the stroke, you write the types of the stroke. Some strokes are normal stroke, some strokes are severe stroke. Okay, these stroke you have to write it down, explain that. After writing the stroke and types of the stroke, go for symptoms of the stroke, how your strokes can be appears. Okay, and after some one more question, I will tell you how to write common causes for all the diseases. For all the diseases, common causes, common symptoms. After writing the symptoms, go for causes. After writing the causes, see one more very important. If the question is asked for 10 mark means, okay, you should write complication also. Complication also you have to mention there, and also risk factor. Risk factor also very important. Complication is very simple. See, you write for all diseases. You write the kidney damage, brain cell damage, lung diseases, lung cancer. Okay, then you write sometimes I don't believe in brother what you told, what you wrote I don't know, so please I don't believe in you because yesterday you said PIC 6 question will come but only one question came. Brother, did you read the question paper or not? Are you from RGHS University? Then which university? Okay, in yesterday's question paper, what questions I have repeated now? Maximum questions are asked from that only. 2 marks, sir. 2 marks question, sir. 2 marks here, Anjali. 2 marks question, sir. Yeah, I will tell you. See here. Okay, what you asked now, sir. I have read. You are told only 6 questions have came from your yesterday's discussion. See, just to read once again the question paper. 90% questions what I had repeated in my yesterday's class. Today in pharmaceutical inorganic chemistry, the same questions are repeated. Okay, you can ask for my any subscriber in this video. Those who are attending the session, no, you can ask me there. Means you can ask for any subscriber there. Is it right or wrong? Sir is saying right or wrong. See, this is not a talent of mine. Okay, the question paper settled like that. Every year they will frame the same questions from the question paper only. The main important thing is you have to invest your brain there. Clear? In pharmacy inorganic chemistry, I have told chloride limit test, sulfate limit test, then I have told impurities, then buffers I have told. Many questions, magnesium sulfate also I have told you. Then, okay. Now, let's concentrate on pathophysiology. Now, brother, you leave that inorganic chemistry. Now, concentrate on the patho. Yes, where we are. See, don't write directly pathogenesis. Okay. Don't write directly pathogenesis. First, you write what is the disease, then the types of that disease, after causes, symptoms, complications, risk factor, diagnosis, and treatment. This is for 10 mark. If they ask for 5 marks means I will tell you. One more question I will take. See. This one. Explain etiology, pathogenesis, morphology of reversible cell injury. Now in this question what you have to do means first you have to write what is this cell injury. Okay, what is this cell injury? Means due to the stress on the cell, what happens? The morphology of the cell changes. That changes in the morphology leads to the cell injury. There are basically two types of cell injury. One is of reversible and another one of irreversible. First you write what is this reversible? Means the damaged cell can be reversed. Irreversible, the damaged cell occurs to the stage of a cell death. That leads to necrosis and apoptosis. This is irreversible cell injury. After that you write the causes for the same. Causes for same, reversible also same causes, irreversible also same causes. Just recent I have made a video on that. Okay, same causes. One is acquired causes, genetic causes. In acquired causes means like environmental causes. This is also acquired causes. So like in physical causes. Okay, in physical causes like electric shock. This is also cell damage or slipping down means while we are bicycling, no, then accidents You can write down that. While cooking, that also leads to cell injury. These are the causes. Okay, maintain that all causes. Then genetic causes means mainly which one? Chromosomal causes, Mendelian disorder. Okay, multiplication of the genes, multiplication of the chromosomes. These all are the genetic disorders, means genetic causes. After writing the causes, write the symptoms of the reversible or irreversible cell injury. Both for them, both symptoms are same. What the symptoms say? Say redness, pain, then inflammation. I will tell you same causes for all diseases. You don't worry. See, maximum thing. Okay, you got here this reversible and irreversible, and the reversible cell injury, irreversible cell injury, pathogenesis are same here. Same means lagbhag almost 90%. Now I made the video for that. Rest recent 1 hour later or 2 hours back, I made a video, uploaded a video on that. You can observe that. See, in reversible, what happens? Only it condition, the condition acquires apoptosis. But in irreversible, what happens? The condition of the cell goes to the necrosis. What happens there? In the irreversible, the damage to the nucleus, mitochondrial damage, ribosomal damage, nucleus damage, that leads to the damage to the DNA. It is in irreversible. But in reversible, what happens? There will be mitochondria not damaged. Why? Means only outer layer of the cell gets a little bit damaged. So for that reason, what happens? Due to the decrease in the ATP production, that leads to eczema or hypoxia, that leads to microbial mitochondria, that leads to cell membrane little damage, not whole cell membrane, little cell membrane damage, that leads to influx of the sodium and efflux of the potassium. Okay, this is in reversible. But in irreversible, there is a mitochondrial damage, a ribosomal damage, that leads to protein deficiency or decrease in the protein. This everything you have to mention. Okay, now I will tell you what causes you have to mention in every answer. Main causes here. See, if you don't know anything, means you write genetic causes, environmental causes. These are the two important causes. One is a genetic one, then another one is an environmental one. Okay. Now some more causes means now see, for an example, for diabetes mellitus, there are different causes. Genetic causes, it is one of the major cause. Then environmental causes, it is also one of the major cause in diabetes mellitus. Then causes also occurs due to the consumption of the food, high concentration of carbohydrates, high concentration of consumption of the carbohydrate materials, that also increases your glucose level. Okay, then drinking plenty of water, that also causes for the diabetes mellitus, means continuous urination. Your body cannot control the urine. Why? Because increase in glucose level. Your kidney are not dialysing that. Your kidney are not controlling. Your liver is not separating the urea. So that's why what happened. The urine is directly secreting from out your body. Okay, and also some of the major causes, insulin resistance. It is also one of the important cause. These are the diabetes mellitus. Now, main causes I have told you: environmental cause, then genetic causes, familial causes, family. If the father is attacked by the disease, means now to the second generation the disease will be attacked. This is the familial, family. These are the basic causes. Now basic symptoms, see, for every disease you understand. One is a fatigue, vomiting, then fatigue, vomiting, hunger, means appetite, anxiety, depression, then sweat, breathing problem, chest pain, then diarrhea, then thirst, excessive hunger. These all are the basic symptoms. For every disease, if you write these symptoms, means no problem, you will get the marks. Symptoms, causes, you will get 3 marks for that. Now complication, I have told you, complications, see, Complications, main complications is heart disease, brain attack, sometimes stroke you can call it, then nerve damage you can call that, then kidney failure, lung diseases or lung cancer, pulmonary diseases or pulmonary cancer, bronchial cancer, breast cancer. These all are complications according to the diseases. But if you write this complication also, you will get the marks. You don't worry about that, my dear brothers and sisters. Now, risk factor C, aged person will be attacked by this diseases very quickly than the youngsters, because due to the improperment immunological property. Okay, because of the weak WBC in the elders, there what happens, their body cannot fight quickly towards the microorganisms, so they will get easily attacked by the microorganisms, that they can be easily comes on the hands of that disease. Okay, so aged persons, main risk factor is for aged persons. And in thyroid, main for women, goiter, what we are quoting, no, goiter, nodular structure, or the lumpy structures where in the neck side or just above the Adam's apple. Okay, these are the risk factor. Now diagnostic technique means one is blood test, you have to write it down. Computerized blood test, this is also one diagnostic testing. Okay, then reagent used, for an example using of barium sulfate to diagnose the test. Okay, now if they ask HIV means, at that time what you have to write, in HIV, in HIV any common treatment I will tell you. Okay, first diagnosis test techniques in HIV, first what we are doing, simple blood test, it is a simple. Then one more important test, that is a genetic test what we are doing today. Okay, that is a polymer what a genetic engineering test we are conducting, no, in today's in modern systematic days, we are confirming the genetic test, genetic material, genetic engineering, everything depends on that only. ELISA test, enzyme linked immunosorbent assay, it is also a common test for patient suffering from the sexually transmitted disease. Not only this one, many diseases like gonorrhea, Neisseria gonorrhea, we are doing this one. ELISA test, this is also conducted for the which one, HIV patient also, then AIDS patient, HIV patient, Neisseria gonorrhea patient, syphilis patient, then in sometimes COVID patient also we are using this one, ELISA test. Okay, now treatment. See, for bacteria, if the disease is a bacterial disease like TB, tuberculosis, you mention amoxicillin is the first line treatment for that. Amoxicillin, potassium clavionate, amoxicillin, bacterial diseases. If the disease is a viral disease, laminavir, viral diseases, favipiravir, rabipiravir, rabies injection what we are giving, no, on the bite of the dog, rabies vaccine, rabies virus it is, to inactivate that rabies rabies, we are injecting the rabies injection vaccine. So treatment is very simple, you write amoxicillin, potassium clavionate, cephalexin, cefodoximine, cefixime, then ceftriaxone, piperacillin, tazobactam. These are the some common treatment. See, already you have completed now 60% in this only. See what they have given, asthma, explain the pathogenesis and clinical symptoms of asthma. First you write what is this asthma. Asthma, it is the bronchial disease or the lung disease in which the body shows hypersensitive or hyper alertness to the allergens. Okay, this condition is known as asthma. You write first this one. And more than 1 million is suffering from asthma in the India. After writing the asthma, you just write types of the asthma, like early stage, middle stage, late stage. If you don't know anything, means you write the stages: early stage, middle stage, last stage. If you know particular asthma types, means you write intrinsic asthma, extrinsic asthma. Intrinsic means inside the body. Extrinsic factors or the extrinsic asthma is nothing but the due to the attack of the this one allergens, pollen grains, dust particles. These all are the extrinsic asthma. Intrinsic means inside the body only. Okay, these are not attacked by the outside particles like foreign particles. No, no, inside only, like autoimmunological disorders. Okay, immunity, self immunity, activation of the self immunity. These all are, what is this? This is the intrinsic asthma. After writing the asthma, you go for causes, simple causes, environmental causes, genetic causes. Okay, see 10 marks questions. What happened? I have made where video just on at morning only. I have uploaded that at 11 o'clock or 11:30 maybe. You go and observe there. There I have made a 10 mark, 5 mark. See, I have told you in 10 marks pathogenesis is very important. Before writing that pathogenesis, first to write the disease name, then types of that disease. After writing the types, you go for causes, then you go for symptoms, then you go for complications, then risk factors. Then after going to risk factors, you go for where treatment. In 10 marks I am telling. At last you go for pathogenesis. Okay, and pathogenesis, you draw a chart. Chart is very important in pathogenesis. After that, explain that chart. This is the methodology. This is the correct way to write the pathophysiology paper. Now see, any question you take from here. Tuberculosis. Now see, what is this tuberculosis? Tuberculosis, it is the communicable disease which is caused due to the bacterium known as a Mycobacterium tuberculosis. This disease is transferred due to the infected droplets. Okay, now types of this TB. Types of the TB is, one is active TB, another one is latent TB. Now active TB, this latent TB, what happens? This latent TB, it's not so danger, and we cannot call this as a community disease. But it active means what happens? The droplet of this active tuberculosis, so they contains this Mycobacterium tuberculosis. When anyone sneezes or anyone coughs, that droplets of the tuberculosis or Mycobacterium tuberculosis, what happens? They enters into the other healthy person. In that healthy person, what happens? That infect the macrophages, that infect the lungs, which leads to the lung cancer, cell damage, cell death. Okay, what is this? Tuberculosis. TB. First you write what is TB, then you write classification of the TB. If you don't know anything, means you write TB, then you write early TB, means early TB and late TB. Early means it can be for a few days or a few months. Late means lifelong or for years. This basic point you have to write. And 1 million people suffering from India. This is common. After symptoms I have told you, causes also I have told you. Simple basic causes you have to refer, basic symptoms you have to write it down. After that you have to write the pathogenesis in 5 marks. If your page remains, means you are unable to fill the 3 pages, means better you write complications. Yeah, this is the today's information. Clear? Now some more important questions are there. You go through those questions. Chemical mediators and the role of inflammation. Many chemical, what first to write, what is this chemical mediators? Chemical mediators, these are the chemicals where present inside the cell, which gets activated due to the stimulus. They get activated on the action of the stimulus. Initially they are inactive in state. When they will get activated, they are activated only on the attack of the stimulus. Every cell constitutes many cellular mediators like CD4 cells. These all are the cellular mediators only. CD4 cells, CD8 cells, means neutrophils, basophils, okay, and also prostaglandins, leucines, then heparin, then mm, macrophages. Macrophage consists of the many cells, CD4 cells, CD8 cells, then a tumor necrosis factor alpha, tumor necrosis factor beta, interleukin 6, interleukin 3, interleukin 9, hmm, chemokines. These all are the cellular mediators. Clear? You have to write a detail on that cellular mediators. Then the process of inflammation. How the inflammation occurs? Inflammation means by the activation of these cellular mediators, what happens? They get activated, they go and surrounded on the site of injury. That site of injury, what happens? Just they get activated, means injured site get activated, and that leads to the inflammation. This only you have to write. Inflammation, if they ask for inflammation, means you write what is inflammation, then better you write the types of the inflammation: chronic and acute and chronic inflammation. Acute means it is a short duration, chronic means for the long duration, it's occur for the long duration. After that you write same causes, same symptoms, same pathogenesis, risk factors, complications, these all are same. Very simple pathophysiology paper. Writing patho is very simple, but you have to invest your brain there. Okay, same symptoms for maximum disease, same causes, genetic causes, environmental causes. So wound healing. Now see, wound healing, basically wound healing, these are the two processes. One is primary intention, another one is a secondary intention. Now wound healing, what is this? It is the process in which the injured part remodels or the rebuilds its a cell, rebuilds its a morphology. Okay, and it is the complex process. This is known as the wound healing. Now wound healing, it is classified into two types. One is of the primary intention, another in one of the secondary intention. Now in the primary, what happens, my dear brothers and sisters, here the primary intention, it is cured. Okay, it is treated by supplying some of the gums, by supplying some of the plasters, steri pads, then by sieving that or stitching, by giving some of the external neoplasts, medicines. These all are the primary. Now secondary intention, what happens means, without this means what happens, the wound of the particular person is in a heavy breakage of the skin. The skin got more broken. Okay, the skin got heavy broken there. The wound size is there, no, it's enlarged way, heavy. So at that condition, what happens, your body, means we cannot supply this type of the stitching, bleaching, no. Your body only naturally generates some of the chemicals. This type of wound is known as secondary intention. Naturally, synthesizing naturally is a secondary intention. Okay, this you have to write it down. Now after writing this, my dear brothers and sisters, you write which chemical mediators are involved in this primary and secondary intention. Basically that only same chemical mediators you have to write. Okay, this is for 5 marks. Now after writing these 10 and 5 marks, you have to face the 2 marks questions. I have uploaded, sir, can we write generally? Yes, of course. Don't worry, you just write generally, brother. You don't think about anything. Whatever you know, the basic things, write down. Don't worry about that. Now 2 marks, what discussion I have made now, just previous days I have uploaded the 2 marks important questions with answer. Maybe 26 to 27 questions are there. Inshallah, you read only those questions. From those questions will be asked in your examination. 2 marks question. Sometimes, unfortunately, what they will do means they will ask in this 10 and 5 marks. Okay, if they not ask in what questions I have given, no, if they not asked from that, means that they will ask from the 10 and 5 marks questions. So for that reason, I have repeated in many videos, my dear brothers and sisters, some questions which were repeated in 10 and 5 marks, I have not given in 2 marks. The questions which are not repeated in 2 and 5, in 5 and 10, that questions I have given here. I have given in the 2 marks. So please don't leave 5 and 10 marks questions. Read that compulsory. That will be activate you 2 marks. That will give you advantage you in the 2 marks. I have told many times. But what to do? Now see. You practice this way. Just those who are newly added students. Newly added means they don't know anything. Tomorrow is the examination. You just read 2020, 21 question paper supplementary with annual. Enough. With 2 marks questions, supply and annual. Invest the whole night for your tomorrow's examination. Sit in a room. Just eat a little amount of food. Okay, if you eat heavy amount of food means it seems to sleepy. The main cause of you to sleep is the food. Okay, eating curd and rice, taking the bed and going to drink. So today you sacrifice the food. Those I am not telling for all, those who are not started till. Sacrifice the food means important क्वेश्चंस will enough ना सर, बस है जी मयूर भाई, बस है, इतना पढ़िए आप बस. 100% you will pass the examination, you don't worry. Just you give more importance what I have told no in the today's session. Now half an hour we discussed what are important questions. Then basically we not discuss here important questions. We discussed here how to write, what the tricks, techniques. Okay, important question video already I have uploaded. Why I had uploaded early only? Because for your purpose, I have uploaded early only. Because the whole day you want to read, no, so you can read those important questions only. Okay, so I have uploaded that morning only. So my dear brothers and sisters, now from today itself you start reading. From today means for tomorrow's examination, and inshallah after 2 days biochemistry examination will be there. Okay sir, thank you for your support. Okay, welcome. Biochemistry examination after 2 days at the 25th of June. That also I will give you some of the tricks for the cycles. Okay, how to remember the cycles, what tricks and technologies to remember the cycle. Everything is present in our brain only, but we have to take advantage of that. Okay, inshallah rahman, let's meet in the next live session. And also third semester examinations are coming soon. Best of luck for your examination, third semester students. Do well, go well, write well. Okay, be healthy, be smart. In third semester, the first paper is organic chemistry 2. Inshallah rahman, I will conduct the important, I already have given important questions day before examination. There will be live session for your third semester. Don't miss the live session. Attend the live session and take advantage of that. Thank you. Assalamu alaikum.